At 28, Emma Riley had lived most of her life feeling invisible. Her blonde hair fell softly around her shoulders, and her blue eyes held a gentle intelligence that few people took the time to notice. She worked quietly as a librarian in the small town where she'd grown up, surrounded by books that had become her truest companions. For years, Emma had carried a burden that seemed small to others, but felt enormous to her. Born with a condition that left her feeling self-conscious about her appearance. She had watched friends marry and build families while she remained on the sidelines, convinced that no one would ever see past what she perceived as her flaws. The decision to have surgery hadn't come easily. It took months of careful saving from her modest library salary, and even more months of gathering the courage to make the appointment. Emma wasn't seeking perfection. She simply wanted to feel comfortable in her own skin, to walk into a room without instinctively crossing her arms over her chest. Dr. Michael Chen had built his practice on something unusual in the world of cosmetic surgery: genuine compassion. At 32, he was younger than most surgeons in his field, with kind, dark eyes and a gentle manner that immediately put nervous patients at ease. His success had made him wealthy, but money had never been his motivation. He had entered medicine to help people heal inside and out. The morning of Emma's consultation, she sat in the elegant waiting room of Dr. Chen's practice, her hands trembling slightly as she filled out paperwork. Everything around her spoke of success and sophistication. Marble floors, tasteful artwork, fresh flowers, and she wondered if she belonged in such a place. Emma Riley. A nurse with a warm smile called her name. Dr. Chen's office was different than she'd expected. While professionally appointed, it felt more like a comfortable study than a sterile medical space. Family photos sat on his desk. Parents who looked proud, a sister in her graduation gown. Books lined the shelves, not just medical texts, but novels and poetry collections. "Please have a seat, Doctor," Chen said, gesturing to a comfortable chair across from his desk, rather than the intimidating examination table. "I like to talk with my patients first, to understand not just what they want to change, but why it matters to them." Emma had rehearsed what she would say, but sitting across from this doctor who looked at her with such genuine interest, the prepared words fell away. Instead, she found herself speaking from the heart. "I've never felt normal," she said quietly. "I know that might sound silly to you. I know there are people with much bigger problems, but I've spent my whole life avoiding mirrors, avoiding swimming, avoiding living." "Really, doctor?" Chen listened without interrupting, his expression thoughtful rather than clinical. "It doesn't sound silly at all," he said finally. "Physical confidence affects every aspect of our lives. The goal isn't to change who you are, Emma. It's to help you feel like yourself." Something in his voice, a warmth that went beyond professional courtesy, made Emma look up and really see him for the first time. This wasn't just a surgeon performing a routine consultation. This was someone who genuinely cared about her well-being. "Can I ask you something personal?" Dr. Chen said, leaning forward slightly. "What would change for you if you felt more confident about your appearance? What would you do differently?" Emma thought for a moment. I think I might finally sign up for that art class I've been wanting to take. Maybe I'd go to my high school reunion instead of making excuses every year. Maybe I'd stop hiding in the back row at church." Dr. Chen smiled, and Emma noticed how it transformed his entire face. "Those sound like wonderful goals. Let's talk about how we can help you achieve them." The surgery was scheduled for a month later, giving Emma time to prepare both physically and emotionally. During that time, she found herself thinking often about Dr. Chen, not just as her surgeon, but as the first person in years who had really listened to her fears without judgment. On the morning of the procedure, Emma arrived at the surgical center feeling nervous but determined. Dr. Chen stopped by her room before the surgery, still in his street clothes, looking more like a concerned friend than a doctor about to perform a procedure. "How are you feeling?" he asked, pulling up a chair beside her bed. Scared, Emma admitted, but ready. That's exactly how you should feel, he said gently. Emma, I want you to know something. I've been doing this for 8 years, and I've learned to see beyond the physical reasons people come to me. You have a light in you, a kindness and intelligence that has nothing to do with your appearance. This surgery is just about helping you see what I already see. Emma felt tears prick her eyes. Thank you for saying that. I'm saying it because it's true. The surgery went perfectly. When Emma woke up in recovery, she felt different in ways she hadn't expected. Yes, there was physical discomfort, but beneath that was something she hadn't felt in years. Bob. Dr. Chen checked on her personally throughout her recovery, something she learned later wasn't typical for such a busy surgeon. During one visit, she found the courage to ask him a question that had been nagging at her. Dr. Chen, can I ask why you became a plastic surgeon? With your skills, you could have chosen any specialty. He was quiet for a moment, adjusting her bandages with gentle hands. My sister was born with a cleft palate, he said finally. She had multiple surgeries growing up, and I watched how each one gave her more confidence to be herself. The surgeon who treated her didn't just fix her. He gave her the courage to smile, to speak up in class, to believe she was beautiful. I wanted to do that for other people. Emma felt her heart swell with understanding. That's why you really listen to your patients. Everyone who comes to see me is carrying something heavy. He said, my job isn't just to change their appearance. It's to help them put down that burden. Over the following weeks, as Emma healed, she found herself looking forward to her follow-up appointments in a way that had nothing to do with medical necessity. Dr. Chen had begun asking about her life beyond her recovery, about her work at the library, about the book she was reading, about whether she'd signed up for that art class yet. I did, she told him during one visit, unable to suppress her smile. I start watercolor painting next week. That's wonderful, he said, and Emma could see that he genuinely meant it. What made you choose watercolors? I like how they blend together, Emma said. How you can't always control exactly what happens, but the unexpected combinations are often the most beautiful. Dr. Chen paused in his examination, looking at her with an expression she couldn't quite interpret. That's a beautiful way to look at life. Really, as her recovery progressed, Emma began to notice changes beyond the physical. She stood straighter, made eye contact more easily, spoke up in conversations instead of staying silent. But more than that, she found herself drawn to this doctor who had seen her at her most vulnerable and treated her with such dignity. During what was supposed to be her final appointment, Dr. Chen seemed reluctant to conclude their time together. He checked and rechecked her healing, asked detailed questions about her comfort level, and finally sat back with a slight frown. Everything looks perfect, he said. You've healed beautifully, Emma. How do you feel like myself? She said simply. For the first time in my adult life, I feel like myself. They sat in comfortable silence for a moment, before Dr. Chen cleared his throat. Emma, I hope this doesn't sound inappropriate, but I was wondering, would you like to have dinner sometime? Not as doctor and patient, but as two people who enjoy each other's company. Emma's heart skipped. I would love that. Their first dinner was at a small Italian restaurant, where they talked for hours about books, travel, dreams, and the small moments that make life meaningful. Dr. Chen Michael, as he insisted she call him outside the office, told her about his volunteer work at a children's hospital, performing reconstructive surgeries for families who couldn't afford them. Money was never the point, he said over candlelight. I became wealthy almost by accident. What matters to me is the moment when a patient looks in the mirror and smiles. Really smiles for the first time in years. Emma reached across the table and touched his hand. That's what you gave me. Not just the surgery, but the way you listened, the way you saw me as a whole person, Emma Michael said softly. From the moment you walked into my office, I saw someone extraordinary. The surgery didn't change that. It just helped you see it too. 6 months later, on a spring evening filled with the scent of blooming flowers, Michael Chen and Emma Riley walked hand in hand through the town square, where Emma had grown up feeling invisible. Now she waved to neighbors, chatted with former classmates, and moved through the world with a confidence that radiated from within. You know what's funny? Emma said as they sat on a park bench watching the sunset. I thought the surgery would change everything about my life, but the biggest change wasn't what I expected. What was it? Michael asked, though his smile suggested he already knew. Learning that I was already worthy of love. The surgery gave me confidence, but you gave me something more important. You showed me that I was enough exactly as I was. Michael pulled her closer, marveling at how this woman who had walked into his office seeking physical change had instead transformed his entire understanding of what it meant to heal someone. Emma Riley, he said, his voice warm with emotion. You are the most beautiful person I've ever known, and that has nothing to do with any surgery. As they kissed under the soft glow of the streetlights, Emma realized that sometimes the most profound healing happens not to our bodies, but to our hearts. When someone sees past our insecurities to the person we were always meant to be and loves us not. Despite our vulnerabilities, but because of the courage it takes to trust someone else with them. In the end, the surgery had given Emma confidence, but love had given her something far more precious. The knowledge that she had always been worthy of being cherished exactly as she was.